Hello, I am Dr. Dhananjay Chavan, dermatologist and hair transplant surgeon from HairMD India, Pune. Lot of people ask about what are the medicines given or prescribed after hair transplant. Yes, after good hair transplant, commonly hair transplant surgeon they prescribe one good antibiotic, some anti-inflammatory analgesic to reduce the pain, topical antibacterial agent or antibiotic, and some vitamins to heal the wound properly and immediately. Within 3 to 7 days, 100% healing occurs on that graft taken area or the area of the body from where the grafts are harvested. Then after 7 days, and in those 7 days, immediately next day or after second or third day, you can wash your hair with the help of shampoo, especially usually very delicate shampoo or mild shampoo, or you can say baby shampoo. It is given, you have to make the foam, apply over the scalp and wash your hair. It will remove your scabs properly and in very short duration of time. Even doctor prescribes saline to apply over the transplanted area where the scabs are forming, and these scabs are removed while taking bath. Important medicines, especially after hair transplant, after 7 days, Finasteride and minoxidil. We can start after 7 days or after 15 days of hair transplant. And to supplement these two medicines, usually doctor gives you vitamins, especially calcium, vitamin D3 for a month or more, 1.5 months to 2 months maximum, biotin and iron tablet, especially essential amino acids or some vitamin supplements in the form of B complex doctor can prescribe. Yes, it is beneficial to have vitamin supplements at least for a couple of months after hair transplant so as to get faster growth of your hair. But finasteride and minoxidil, it forms the mainstay of treatment. See, usually in grade 7 baldness, all hair over the top of your scalp, they are gone. And hair transplant in such cases, if those patients, if they do not take minoxidil, take finasteride or apply minoxidil, okay, it is up to certain level, it was thought to be not of any use of finasteride or minoxidil after hair transplant. But this is not the case. For last 15 years, they have followed various patients and they have found that those patients who are taking finasteride and applying minoxidil, their hair growth, their hair density, it is very good after taking finasteride and minoxidil. Those patients who are not taking finasteride and minoxidil, their hair density has been low. It is reducing. So nowadays it is consensus that or majority of hair transplant or maximum hair transplant surgeon, they prescribe finasteride and minoxidil after hair transplant to prevent thinning of transplanted hair or to preserve the whatever hair they are on the scalp before hair transplant. Grade 7 hair transplant, very few hair transplant surgeon does hair transplant after grade 7, and they can transplant 7,000, 8,000, 10,000, 12,000. We have transplanted 15,000 grafts also in grade 7 hair transplant. My hair transplant, we have transplanted around 11,360 grafts. So we can transplant that And if we take finasteride and minoxidil for a longer time, transplanted hair and whatever hair they were present before transplant also, or those hairs which are at risk of getting bald, they can be preserved or they can be kept there for a longer time and baldness can be postponed. It is my humble request that finasteride and minoxidil, even after hair transplant, you should continue along with important thing. A couple of months in a year, you can take some vitamins, whatever I have mentioned. You can use ketoconazole containing shampoo once in a week because it acts as an anti-inflammatory also, and whatever dryness or whatever dandruff like thing you see on scalp after minoxidil application, it can be taken care of. You can use any other shampoo, cosmetic shampoo or day-to-day hair care shampoo. You can dye your hair. You can do whatever you want to do with your hair. You can curl it, perm it, shine it, or you can use any type of gel or anything after applying minoxidil, sometimes after applying minoxidil, because minoxidil is applied on the scalp and gel and all this thing is applied on hair shaft. So don't be in dilemma whether to use finasteride or not, whether to use minoxidil or not. Use it. It will not hurt you at all. Those patients, more than 99% patients, they do not get any adverse effect due to finasteride, or whatever adverse effect comes, they are temporary and they can continue. So if you are not having any problem with finasteride, take finasteride, it is useful. Apply minoxidil if it suits to your skin. Majority, 99% patient, they are using all these medicine. Thank you. And remember, if you have any question, any problem, you can visit my website hairmdindia.com, where we are putting new information, recent scientific updates on that website. And there also I have kept one window for asking me questions. You can ask on that website also. After looking after that website or going through the contents through in website, if you got any problem, you can utilize that box, write down there and ask me question. Thank you.